how is this happening this way? You know, like it's almost, a lot of people like to talk about how drugs are put in our communities. But, when you get outside, when you release your mind from that small aspect of it, and you look at how these pharmaceutical companies affect the greater population, it's like drugs in our community is small pennies at the bottom of a barrel. Unfortunately, our communities also have the same issue with a lot of these pharmaceuticals. Now, of course, pharmaceuticals have a lot of control over the availability, but we are in a society that's so programmed to self-medicate. It also adds to the issue. And as much as we like to, and as much as we can justifiably blame these pharmaceutical companies, we also have to take accountability for how we operate as a society. Because I know in my family upbringing, in my household, self-medication was a goddamn thing, and nobody thought twice about it. Of course, they put on the bottles, do not take this if it's not your prescription, however they word it. But who the hell really cares and listens to that? And it's like, who the hell can control that? Yes, the pharmaceutical companies control what's on the market and who can access it because of the type of medications they are. But at the end of the day, they can't tell you or force you not to give your prescription of codeine, Tylenol with codeine. They can't force you not to give it to your child or your cousin, your brother, your friend. They can't stop you from doing that. Even if your doctor prescribes it to you, they can't control you giving your Tylenol with codeine to anybody else. They can say, no, you can't, but they can't stop you. So, I mean, when you talk about the availability and access, the best they can do is put it on the market and where it is authorized to be distributed. But once it leaves from there, that's all they got.
Yeah, I mean, it's just like anything else, man. Really, like when we talk about how our government strategically place drugs within some of our communities. Mm-hmm. Again, at the end of the day, no one made those participants participate. Whether you were selling it, hustling it, peddling it, or consuming it, no one made you do it. So it's kind of like the same thing with pharmaceutical products. They put it out there, but they can't make you take it.
Mm-hmm.
It's I don't know, man. It's crazy because again, people out here are in pain, man. Whether it be mental, physical, or all the above, as they say. So they're looking for relief. So when they go to these CVS's or Walmart drugstores or whatever the hell you want to call it, they are looking for something to help them with their pain, whatever their pain may be. So it's kind of like, I don't have to push it on you. One thing I gotta do is put it out. This shit gonna sell like hotcakes. It's sad, but that's just what it is, man. is one of the greatest schemes anyone could have came up with. Because on